again back to Boond Soch की Tea Talk Train of and Thought with a series of an episode with Dr. Chris D'Souza. So welcome to another episode.
Thank you, sir. I'm happy to be here.
It's our pleasure. Now, if we'll see the important organs of our body is an ENT, and I'm sure like we should take care of all the parts which are gifted to us. And now we have got Dr. Chris D'Souza. We'll just take in further questions from him. So, what made you opt for otolaryngology? Like
ENT was a much sought after discipline in medical college. I was very fascinated by the fact that it was very delicate surgery and the restoration of hearing and hearing function in people. We had a mixture of microscopic surgery as well as macroscopic surgery. So that fascinated me, and that's why I chose ENT.
Okay. And normally, if you see the difference between the general physicians and the ENT specialists, like, many of the time we try and approach the general practitioner for a minor problem which are there. But the ENT specialists, like, can you throw some light on that?
Well, the difference between a family physician and an ENT surgeon are quite specific. A general physician will examine you from the head to your toes and will take your blood pressure and things like that. In ENT, everything depends on how you are able to visualize the ear, which you require to be an expert. So you need to have very special equipment, even the back of the throat. So, the amount of equipment and expertise is needed much more than a family physician. However, in recent times, I have seen many talented family physicians who are also able to examine a ear. Apart from examining the ear and nose, we also need to have specific instruments to do certain procedures, like, for example, removal of wax. You need to see very clearly how and where the wax is situated and to remove it gently without injuring the ear. Many people who are ill-trained will make a mistake and cause the patient pain.
So it's advisable to go to a specialist, like, if there's any problem with the ENT as such. That's advice.
Yes, I think it's absolutely important that a person, if they have any complaint relating to ENT, go and see an ENT doctor.
Okay. So now, can you brief our audience about the connection between the ear, nose, and the throat?
Once upon a time, the eyes were also included. That they was referred to the eye, ear, nose, and throat. And so this was perpetuated for many years in the US. But then they decided that since these are really two different entities, that they excluded eyes from ENT. The ear, nose, and throat are intimately connected because everything opens at the back of the throat. The nose is the pathway through which air will enter your lungs, but at the back of the nose is the eustachian tube that connects the ear to the nose, and that's how air will enter the ear. The same thing for the throat. It is a common passage for all these organs. That's why ENT are intimately associated, and that's why the eyes were excluded from ENT as a curriculum.
Okay, so it's ENT like now.
Yes.
Okay, so what are some common cases you see in a day of an otolaryngology like?
Well, the common thing that we see, of course, which can be related to the pandemic, have been respiratory tract infections. Previously, the nose and the throat were considered upper respiratory tract, and at the level of the vocal cords and below was considered the lower respiratory tract. But the common problem that we see frequently as ENT surgeons are respiratory tract infections. Respiratory tract infections will, of course, involve the throat, will involve the nose, and if it goes beyond, it can extend into the ear. So the ears, nose, throat will get affected by these. So these are very common problems.
Okay. So many of time we see a crossover between the ENT and the surgeon specialist, like, So,
well, there is a lot of overlap, and we concede that, we understand that. As ENT, we have to learn to where to draw the line. Now, there was an old phrase called from the dura
Mm-hmm.
to the pleura. Dura is the covering of the brain, the pleura is the covering of the lungs. So anything in between was considered to be the domain of ENT.
Mm-hmm.
However, in recent times there have been a lot of advances, but every ENT doctor and every doctor should know their limitations and not venture beyond that.
Okay. And so, what are the most challenging and the rewarding aspects of an ENT life?
Well, for me, is the ability to restore hearing. That has become my life's passion, and I no longer consider it as a science. I look at it as a religion which I must follow thoroughly. Once we're able to restore hearing, I've seen a tremendous difference. Children who are born deaf, I've been able to give them the sense of hearing.
Mm-hmm.
They're able to develop like normal children and go and enroll in schools for children with normal hearing.
Mm-hmm.
They lead productive lives, and the tremendous change that has occurred is so for me. Restoration of hearing has become very, 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 very important, and for me, it's a religion.
Oh, I see. So, can you describe the most challenging experience you have ever had in a career?
Well, I've had several. Being at the Tata Memorial Hospital, I had to deal with people who had cancer,
Mm-hmm.
and a rare entity, cancer of the ear. And this was a heartbreaking situation. I've been at Tata Hospital 26 years.
Uh,
And in my very first year at the Tata Memorial Hospital, I had this young lady who had two small children, and she had cancer of the ear. It was very extensive. And her husband was in jail,
oh,
and she had to look after these two children. She had nowhere to go.
mm-hmm.
So she really begged of me to save her life.
Mm-hmm.
And so I did the surgery as the best I could. Unfortunately, the disease was really, really extensive,
Mm-hmm.
and we removed the tumor. We gave a radiation, but unfortunately, the cancer came back, and she succumbed. And I cannot tell you that this particular lady has haunted me all my life because I know she has two small children, nobody to look after them, and her husband was in jail. So I do not know what became of that family, but I will always remember this particular lady whom I could not help.
Oh. So, in fact, I think doctors are also having an emotions. They tried their best to save the patients, but it wasn't real great insights to what you have given about your experience. Now it's we are on the series of an episodes with Dr. Chris D'Souza. I'm sure in our next episode we are going to carry a further story with Dr. Chris D'Souza. Keep on watching Tea Talk एक Boond Soch की train of thoughts. Thank you very much. So thanks a lot for making
Thank you,
this.
sir.